we've presented the ESC's first ever guideline on cardio-oncology here in Barcelona at the ESC Congress 2022. The guideline covers cardiovascular health in cancer patients both before starting treatment, so at baseline, then during their cancer treatment if they're receiving a potentially cardiotoxic treatment, in the first year of follow-up after completing treatment, which is the end of cancer therapy assessment, and then their long-term follow-up for survivors who are at increased risk. So patients who are undergoing active cancer treatment and develop a complication which is cardiovascular are very complex, and there are a number of different factors which influence how we manage the patient. The first is what's the cancer and how mild or advanced is it in terms of prognosis. The second is what's the treatment that the patient's received and what's the known cardiotoxic profile of that treatment. The third is the intensity or severity of the cardiovascular complication and how that can be measured and then ultimately followed to look at responses to treatment. And a key fundamental principle is communication between the cardiologist and the oncologist so that both teams know and understand how important the cancer drug is, what are the alternative treatments if the patient can't stay on that drug, and what are the appropriate cardiac treatments and how we might assess the response. And this will vary depending on is it a heart failure or cancer therapy related cardiac dysfunction, or an arrhythmia, including QTc prolongation, which we cover in the guideline with the new algorithm to manage how you change the dosing as a response to QTc prolongation on treatment. Or is it a thrombosis, arterial or venous, or pulmonary hypertension? So you can see that there's a whole range of potential complications, and they're all covered in the guideline within the section on the management of acute cardiovascular toxicities caused by cancer therapies. So we're now seeing a rapid increase in the number of cardiovascular complications and diseases in cancer patients, and one of the reasons is there's shared risk factors. So risk factors that we know in cardiology increasing the risk of heart disease are now being identified in oncology to increase the risk of cancer. The most famous, of course, is smoking, but now it's recognized that obesity, dyslipidemia, inactivity, and metabolic syndrome, which of course may lead to inflammation, as well as accelerating cardiovascular disease, can also accelerate cancer. And there are potential cancers that themselves may also increase cardiac disease. We know some lymphomas are very metabolically active and release cardiotoxic cytokines, so patients can present acutely with both an advanced lymphoma but also with LV impairments due to the malignancy. And there are specific examples where the malignancy is known to cause cardiac injuries, such as AL amyloidosis, secondary to multiple myeloma, or carcinoid valvular heart disease in patients with carcinoid syndrome, and those topics are also covered in our guideline. A wide range of complications for cancer therapies, and these are all covered in the guideline. Perhaps the most commonly encountered are cancer therapy related cardiac dysfunction due to either anthracycline chemotherapy such as doxorubicin, or HER2 targeted therapies such as trastuzumab for HER2 positive breast cancer. And in the guideline, we discuss the risk assessment at baseline, so that high-risk patients due to pre-existing heart disease or other abnormalities of their cardiovascular health can then be monitored more closely with closer surveillance. We discuss the frequency of surveillance for a range of different cancer therapies causing cardiotoxic problems. and then what to do if a problem arises, how to implement primary prevention and secondary prevention in order to maintain patients on their effective cancer therapy safely. We presented this guideline yesterday morning at the ESC Congress here in Barcelona, and today we've had 2 dedicated sessions on this guideline. It's the first new guideline for the ESC for many years. Other guidelines are updating, and so it's really been an amazing experience, and to hear the energy and feedback from thousands of people coming into the room to listen for the first time to the guideline live. It's now available on the European Heart Journal website, and if you have the ESC guideline app, then you can find the pocket guideline on the app, and you'll be able to use the interactive algorithms to help you make decisions on how to manage your patients with cancer who then develop heart problems during their treatments. And we hope that's helpful. We've had a lot of support from the task force who helped write this guideline, and myself and my co-chair Teresa Fernandez from Spain are really grateful to all the support from both the task force members, our reviewers, and the Clinical Practice Guideline Committee. And we hope you will find the guideline helpful, both to help your decision making and to improve the health and well-being of your patients.